Your urine can be a window to your health. Its color, clarity, pH levels, and the substances that are being thrown out in the urine, their absence or presence, can tell us a lot about your health. Some of the people have observed that they seem to have a foamy urine. So, is foamy urine a serious problem? What is right and what is not? I'm Dr. Maria Matik, and let's talk about this. Sometimes people tend to say that they have noticed a foamy urine. That means even after they have flushed, the foam seems to linger on in the pan. So, normally the urine is supposed to be clear and light yellow in color if the hydration level is good. What happens in this condition? The kidneys are the filter systems of the body, and their work is to filter out the excessive fluids, the excessive water, and the toxic wastes and other wastes that are being produced in the cells of the body. So when the blood passes through them, they filter out these extra materials and the bigger particles, the necessary minerals, the necessary electrolytes, the necessary proteins that are needed by the body. They are usually bigger in size and they are not filtered out. They are retained by the body. But the presence of foamy urine means that the proteins are being filtered out into the urine, which is definitely a sign of proteinuria, commonly albuminuria, and it shows that there is some chronic damage that is going on in the kidneys. Now, there are certain conditions in which the urine normally also becomes foamy, and that is when your bladder is too full and the passage of urine is very, very fast. Then, in case you are dehydrated and the urine becomes extremely concentrated, then too it can appear foamy. Then, in pregnancy, or in certain UTIs, it can have a foamy appearance. But if it is persistently foamy, does not flush out, and becomes more and more noticeable, then it is time to consult your doctor so that you can be evaluated for chronic kidney disease. Now, what are the chronic kidney diseases? Which conditions cause them? And what are the other symptoms along with foamy urine that the doctor is going to notice? It's not just going to be foamy urine, but there is going to be swelling around the eyes. The soft tissue around the eyes will look puffy and swollen, which is called periorbital puffiness. And then there will be swelling around the ankles and on lower legs. This shows that clearly you need to be investigated. Now, what are the conditions that cause it? Uncontrolled diabetes mellitus, when there is prolonged high blood sugar levels, they can damage the kidneys. Then high BP, which is again not treated, which is uncontrolled, can damage. Chronic heart diseases that can cause fluid overload can damage the kidney filter system. Then if there is a family history of chronic kidney disease and kidney failure, then you may be prone to develop it too. Then obesity, being overweight, smoking, alcohol consumption, these can all damage the kidneys. Then repeated urinary tract infections can also damage the kidneys. Then there are certain autoimmune diseases, for example, amyloidosis, in which there is amyloid deposition in the cells, and the kidneys can be damaged in that condition too. Then just overaged, those people who are elder than 60 years old, who are older than 60 years old, they can have a normal wear and tear of the body and they may pass out foamy urine. Then a person's own personal history of acute kidney damage can occur. For example, during some accidents, there's loss of blood and the kidney gets overloaded by lack of oxygen, improper blood flow. Then there are conditions such as drugs, usually when taken on an empty stomach, the normal painkillers, the normal NSAIDs, they can damage the kidneys. Then drugs which the people use, the medicines for blood pressure controlling, for HIV, for cancer treatment. These can all affect the kidneys. Even the ulcer medications, if they are taken for a long time, then they can affect the kidneys too. Then the illegal drugs that the people are using, the addictive substances, cocaine, alcohol, heavy metals, they can all damage the kidneys. And then there may be a sudden impaction of a renal stone, which can affect the filter system of the kidney and cause an acute damage. So there are so many reasons in which the urine can get foamy. Now, what is the treatment? There really isn't any treatment for the chronic kind of kidney disease, and the only thing you can do is to try to relieve the symptoms and try to make the progress of the disease slow by proper treatment of the causative factors. Then for the acute conditions, obviously the doctor is going to tell you how to treat the different conditions that have caused the damage acutely. Otherwise, people may not just need medicines, they may need dialysis also, in which the kidney filters work is done by a dialysis machine, and this is the only way for the people to sustain their life and live properly. So, what you have to do on your part to prevent this chronic kidney damage? If you have blood sugar, if you have diabetes, keep the blood sugar levels in control by proper medication. High blood pressure needs to be treated and kept in control. Obesity, you have to control it by proper diet, proper eating, proper workouts. You have to stop smoking. You have to decrease your alcohol consumption, and you have to keep yourselves hydrated at the proper time before any kidney damage occurs, and the kidney cannot hold the overload. So drink lots of water, keep your kidneys flushed, keep your kidneys clean, and normally do not take your medicines unless it is prescribed by the doctor to take them on an empty stomach. Just do not keep on popping your pills without eating anything. So stay safe, share the information, and if any of your near or dear have this problem of noticing foamy urine, do contact the doctor and save yourselves from more bigger problems. Assalamu alaikum, and thank you so much. Have a nice day.